Once you have created your patient profile, you'll see your patient name appear. This allows you to get going on the patient profile where you could add goals, diagnosis, and medication. The client can also add diagnosis and medication if they want, but you can also add it from your side. There are two options here for a therapist. They can either enter a full assessment by clicking on New Assessment, or they can rate therapy areas. We often recommend when therapists are first getting onto SpecialT to rather click on Add Therapy Areas. This opens up the categories within their profession where they can go in and they can rate the specific areas. You don't need to rate each area. You can just rate the ones that are appropriate. And at any stage, you can come back and you can add additional areas to the patient profile. This obviously allows you to know exactly what you are working on with the specific patient and kind of tailor a program that's specific for your patient and their areas of need. A therapist can also put an average and above average results, and at any stage they can come in and update them to show the progress that the patient makes. If you do want to add a full assessment, you click on the New Assessment button. This allows you to rate the therapy areas that you are working on and that you have identified within your session that need to be worked on. But it also gives you the option to add your information from your assessment. So you can enter information about your interview. This gives you options on whether you want to bullet point all the information from your interview. You can also highlight and underline things of importance. We have recently added a table feature. You can enter a blank table, or you can create specific tables that you want to use and have templates. So I can come in and I can write Heather and then add all Heather's details here as well. Obviously on the computer there is more space, so it's easier to also have more space for all the tables that you create. You can add rows and columns and then create templates that you can use each time. Remember that you can change access, so if you don't want the client to see this information, you make it therapy only, and the client then won't see that bit of information. If you want to add another note that you do want the client to see, then you can also see how you make that information shared. There are options on adding a link. If you have a hyperlink to various documents, you can also use that. You can see the first note will be private and the second note will be shared. You can add as many documents as you want. Obviously, this gives you the option to either take a photo of something that you're doing within your therapy session, where you can enter your assessment details and add extra information. Again, you can decide if you want to share it or not, and that information gets saved. You can also upload documents from your own gallery. So if you have specific pictures or documents and videos within your practice, you can see how easy it is to add, and then to go in and add a note or change your status on each of those. So this is if you want to add a full assessment. It gives you the option to add documents, videos, photos. You can save it as draft or you can send it. This also allows you the opportunity to upload a PDF of a specific assessment information. You can then confirm the duration of your assessment and the time, or save it and come back at a later stage. When you are ready, you can save your information or send it. When you send it, that confirms the information for your client. Your client will then see that information.